Welcome to this episode of Transforming Tomorrow. My name is Eric Carey, Chief Information Officer for Valley Health System. Today I am pleased to talk to you about our new nurse server technology. It's a two-sided cabinet technology with doors in the hallway and inside the patient room, and it's designed to improve the patient experience. And the top part of the cabinet is the supply area. In the middle is a medication management area, and in the bottom is a dirty linen storage area. Together, these three are able to be opened and closed and accessed from inside or outside the patient room. This is designed to avoid disruption for the patient, give them more peace and quiet, and improve their healing cycle.
So one of the biggest complaints we get is, we're here to rest as you're healing through your procedure or the reason why you're in the hospital. We want to make sure we decrease the amount of interruptions. So if there is a member of our team that's coming into either stock or change linens or empty trash, we don't want to disrupt our patients while they may be resting. So that can be done outside of the room through our nurse server process. So that's less interruptions that our patients and our care teams will have.
And now let's hear from the subject matter experts to provide more details.
The nurse server basically allows for supplies and medications to be kept securely at bedside, but more importantly, it allows for ready access to the supplies from the patient room, but also a means of stocking those cabinets from outside in the corridor without disturbing the patient.
The goal is to ensure that we have adequate supply on the units so that nurses have what they need to provide the best care for our patients.
So currently in Ridgewood, we have clean supply rooms, and oftentimes all the supplies and the linens will be stored in there, and they're centralized throughout the unit. But on the larger units, you're walking, across down the hall, around the corner to get your supplies. You'll have the supplies right in front of you, in your hands, in the patient room. Oftentimes we'll forget something, we'll say, I need an alcohol swab. Let me run out and get it. You won't have to do that.
We're developing a mother cart for the nurse servers so that someone will just take this cart with those essential items and they can go around and restock the nurse servers.
There's color-coded drawers, so everybody knows, what items are pertain to every section of that nurse server.
Right now, if they have to dispose or change any linen, they have to walk to the soil utility room. Now, it's like they're going to have right there in the patient room close to them.
So we have pretty much a stock design for a medical surgical patient, one for a critical care patient, a pediatric patient, and so on and so forth. So the benefit would be to the staff that certainly from room to room, it's the same supplies, they're in the same location. And if, for example, I am floating to another med-surg unit, I would expect to find those same supplies in the same location as compared to perhaps the med-surg unit that I floated to the prior shift.
So we've been working with a lot of departments. We did a trial on Fort East where we're utilizing the color-coded system, and we invited people from the different med-surg department. We're also working with the ED, we're working with critical care. So we're working with a number of departments to ensure that we have the right information to provide supplies that's needed.
We're going to be doing mock-up operations, and so I think it'll be interesting to, find our way to all the stakeholders doing what they need to support the server, and go through those motions and see how it works out so we can fine-tune it.
We're building a new hospital, and this is very exciting. And right now we have the opportunity to design and build processes that will ensure success for everyone.
I'm Kathy.
I'm Orville.
I am Judy.
And I am Howard.
I'm Flavia, and together we're transforming tomorrow.